Degenerative disease of the cervical intervertebral disc can cause spinal stenosis. Protruding disc tissue can put pressure on the nerves that travel through the spine, which can lead to serious consequences. One of the treatments is cervical disc total replacement with Disc-C implant. A thorough discectomy is performed first to completely eject the disc and release the spinal cord. Vertebral end plates are then prepared to ensure placement of the implant and create a vascularized surface for stimulating bone growth. The trial system is placed in the cavity between the vertebrae to select the correct implant size. Then the keel cuts are performed for enhancing implant stability. A suitable size implant is placed using the inserter, aligning the keels with the keel cuts. The kinematics of Disc-C implant correspond to the joint guidance in vertebral joints. Therefore, the implant restores both the height of the disc and segmental motion in the cervical spine.